Table to gurney transfer. You are asked to go to the X-ray room to help transfer Miss Ivory from the table to the gurney. Miss Ivory has suffered a cerebral hemorrhage 6 days ago and has paralysis on her left side. You will be transferring her from the X-ray table to the gurney with the help of 2 other technologists. So we have verified that this is Miss Ivory, the person we're supposed to transfer, using 2 forms of ID, her birth date and her last name. So we know we've got the right person. And we will be transferring her from the table to the gurney, which is locked, and it's a little bit higher. The table's a little bit higher than the gurney, so that we're moving her from a higher place to a lower place. We have gravity on her side, and it'll be a smoother ride for her. So we will be tilting her onto her stronger side also, since her left side has paralysis. We'll be tilting her this way to move her onto her strong side. I'll be standing here supporting her head because with her recent brain hemorrhage, she's in kind of a weak place. So I'm going to make sure that the head is supported. So, Miss Ivory, my name is Jonathan, this is Jose, this is April. We're going to be moving you from the table here to the gurney. What's going to happen is we're going to tilt you toward Jose. April will slide a thin plastic board underneath you, and then we'll glide you over onto the gurney. Alright?
Okay.
Alright, so I'm going to go ahead and grab your hand here. We're going to take your hands across your body, and you can, perfectly bring that other one up, and just hold that there. We'll do the rest of the work. So, I'm supporting your head. On the count of 3, Jose, we'll roll her towards you. 1, 2, 3. April with the board, excellent. Now on the count of 3, we'll take the sheet and move her over to the slider board. 1, 2, 3. And now on the count of 3, we'll move just the sheet over to the gurney. 1, 2, 3. Now this whole time we have been standing with a wide base of support to make sure that we are protecting ourselves as a technologist. We're moving as a team so that we are all bearing the weight evenly. Are you all right, Miss Ivory?
Yes.
All right, we'll pull up that guardrail, which would probably be the very first thing we would want to do once we move her. We unlock the gurney so that we can slide it away just enough to bring up this other guardrail, and we are ready to travel.
So scenario number 2, you're asked to transport an 85-year-old female, Miss White, who just had right total hip replacement 4 days ago. She's able to stand with assistance, but still weak from the surgery. I'll be transferring myself from the wheelchair to the X-ray table. Hello, Miss White. My name is Jose.
Hi.
How are you doing?
I'm okay.
Can I verify your date of birth and your full name, please?
Consuela White. Date of birth is January 1st, 1929.
Okay, perfect. Alright, so we're going to move the patient close to the X-ray table, and we're going to position her 45 degrees to the table, and we're going to position her this way because her left side is the strong side since she had a right total hip replacement. And I locked the wheelchair so it's not going anywhere. And now I'm going to get rid of these foot steps. Okay, so what we're going to do is we're going to transfer you here, and I'm going to assist you. The first thing I want you to do is to scoot over to the end of the seat. There you go. You doing okay?
Yeah.
Okay. Now what I want you to do is to put your hands on the end of these handles, and I'm going to put my foot in between her knees, and I'm going to have a wide stance for better support. And on the count of 3, you're going to stand up, and I'll put my hands under, and then we're going to pivot. Okay?
Okay.
So 1, 2, 3. Alright, are you feeling okay?
Yeah.
Alright, now we're going to pivot. And now her thighs, the back of her thighs are going to be against the table. And I'm going to ask you to sit down. Alright? And can you scoot over? Yeah, there you go. Alright. Are you doing okay?
Yeah.
Alright. I'm going to get the wheelchair out of the way. And we're going to get you to lay down in the bed. Alright, Miss White, how are you feeling?
I'm okay.
Alright, so Ms. White is here and she's ready to begin her procedure.
Alright, so we are doing scenario number 3 right now. This is the transfer where we're going to do a wheelchair to the stool to the table. So scenario number 3, you're in an x-ray room. A technologist has asked you to get a Miss Roberts out of the wheelchair and onto the table using a step stool. The patient has an injured left knee and the table cannot be lowered. Once the exam is done, you must now get the patient off of the table and back into the chair using the step stool. So that's what we're going to do right now.
Alrighty. Alright, Gertrude, before we get anything started, I just want to make sure you're the right person that we're going to do the exam on today, okay? So can I get your last name, please?
It's Robert.
Perfect. And what is your birthday, Miss Roberts?
It's July 11th, 1935.
Alright, awesome. I think we got the right patient. So what we are going to do is, can you just let me know what your strongest side is on your body?
This will be my right side.
Alright, perfect. So this is what we're going to do. We are going to wheel this wheelchair at a 45-degree angle closest to your right side, or your right side getting closest to the table. It'll make it a lot easier for us to get you onto the table.
Okay.
So we do have this step stool here because our table unfortunately doesn't lower. So I'm gonna move this a little more
That's a
this
shame,
way.
dearie.
Yeah, but you know what? We have each other to help us get you onto this table, okay? So what I'm gonna do is, this wheelchair is locked into place. These wheelchairs happen to just lock once you let them go. So that's all set. She's not gonna go anywhere. We're just gonna get these foot pedals out of the way. And you can step onto the ground if you'd like, Miss Roberts. Perfect. Great. So what I'm gonna have you do is scoot up towards me as much as you can. You're gonna push up on those arms. Perfect. And for this part, I'm just gonna put my foot in between you just to have a better stable support to lift you up. And what you're gonna do is you're gonna push up on those arm rests, okay? And on a count of 3, we're gonna do that together. Do you think we can do that?
Yes.
All right, perfect. On a count of 3. 1, 2, 3. Great. How you feeling?
I'm a little dizzy.
Okay, so we're just gonna stand here for a moment till you feel better, okay?
Okay. I feel better
Okay.
now.
All right, perfect. I'm just gonna get Jose to come in here and take this wheelchair out of the way, just so we have more room to work with, okay?
Okay.
All right, perfect. So the next step we're gonna do is we're gonna actually pivot you towards the table, and then when you feel the back of your thighs against the table, let me know, okay?
Okay.
All right, that's what we're gonna do. Ready? 1, 2, 3.
All right, I can feel them against
You're
the
good?
table.
All right, perfect. So now what we're going to do is we're going to use this step stool, and you're going to step off into the step stool. I'm going to bring it a little closer, okay?
Okay.
Alrighty. So you're going to use your strong foot, your right foot to step on. Make sure you hold on to this, okay? This brace is going to help you.
Alrighty.
Alrighty, up you go. Right foot, and have your left foot to follow. Perfect. You think you can sit on the table from here?
Sure.
Alrighty, can you just hold on to this table for me and scoop yourself up?
Alright.
Got it?
Yeah.
Alright, I'm just going to get this out of the way as well. We're going to
Okay.
need to lay down for this procedure. You think you can do that?
Sure.
Okay. Let's try it out.
Oh boy. Oh, here we go.
Alright, let's try it.
Okay.
Alrighty, now you're ready for your exam.
Yeah.
Alrighty, so Miss Roberts has just finished her exam, and we're actually going to get her back to the wheelchair. Again, this table does not go down, so we're going to use the step stool to aid her into this transfer. What we're going to do is move this step stool on the opposite side, right here. It's going to be easier for her to get her back onto the wheelchair, considering that this is her weaker side, and she's going to need this for support. Alright, Miss Roberts, just scoop this under you. Perfect. And what I'm going to have you do is scoot up on that table for me, please. Thank you. Alrighty, and you're going to hold on to this bar for some support, and we're going to step onto the step stool.
Okay.
On whenever you're ready, okay? 1,
Alright.
2, 3. Alright, great. So now what we're going to do is we're going to actually step off on your left side, and you're
Okay.
going to hold on to that bar, okay? So whenever you're ready.
Alrighty, here I go.
Great, perfect. You okay?
Alright.
Alright, sounds good. So Jose's actually going to come in with the wheelchair. Perfect. Thank you, Jose. And do you mind taking the step stool out of the way as well? Alright, great. I just want to make sure she has as much support as she needs. Alright, great. So Jose actually put the foot pedals out of the way on this wheelchair. The wheelchair is locked, so we're going to scoot you over and pivot you behind this wheelchair, okay?
Okay.
You got that?
Yeah.
Alright, let's get you seated.
Okay.
Alright, you scoot back. And I'm just going to put these foot pedals down for you, Miss Roberts.
Okay.
Alrighty. You okay?
I'm good.
Alright, and now Miss Roberts is all finished up with her exam.